A new amendment might be just what the Republicans need to get some of the far-right congressmen to sign on to their health care bill, but it might also be what they need to make your health insurance a joke worth nothing and make a bill that was already incredibly unpopular even more repulsive to the moderate Republicans in the Congress and to regular people who weren't sold to begin with. So the amendment would allow states to opt out of some politically popular Obamacare provisions, like the requirement to charge sick people the same prices as healthy people, or to cover a core set of benefits. Or, in another way, actually have your health insurance protect you against getting sick. Weird idea, but they're gonna let states opt out of that. If enacted, largely, it would allow states to recreate the conditions that existed before the Affordable Care Act took effect. Because at the end of the day, the Affordable Care Act was not just about having people technically have health insurance, it was about protecting them from bankruptcy if you were to get sick or simply getting increasingly sick and dying. And that's what they're hoping states will be able to opt out of. Now, bear in mind, this is an amendment to the bill that we've been talking about on TYT. That bill was a disaster before this amendment. Reminder, the CBO predicted that the number of uninsured Americans would climb by 24 million if the law took effect. That was before this amendment. And let's talk about what this could actually mean for you if this amendment actually goes into effect and if they actually pass the bill. Well, a recent analysis examined the likely effects of such a proposal on premiums for people with medical conditions. This is the ability to possibly let them charge different rates based on if you're sick or healthy. For conditions like asthma or diabetes without complications, the researchers predicted insurers would seek premiums more than twice as high as the standard rates. Bear in mind, diabetes is one of the most common health problems in America and growing more common with every passing year. For people with something more serious like metastatic cancer, the researchers concluded insurers would ask for premiums 35 times higher than usual, pushing premiums well beyond $100,000 a year. Now I know it's crazy, nobody gets cancer in America, you don't have to worry about that. But if that crazy day were to happen, if this is in effect, then your health insurance premiums could go up, not just going up by 20% or just doubling, going up by 10, 20, 30 times. And that's what they're working for right now. Now, scarily, they seem to be getting some traction with it because some of the people who are holding out against previous versions of the bill are suddenly a little bit happier. The Freedom Caucus released this statement saying, while the revised version still does not fully repeal Obamacare, we're prepared to support it to keep our promise to the American people to lower health care costs. We look forward to working with our Senate colleagues to improve the bill. And that's right, it doesn't fully repeal Obamacare, it just makes Obamacare basically worthless for regular Americans. Statement from Club for Growth president, we're not gonna read the whole thing. They're now signing on, we got Freedom Works, they said they would immediately withdraw our key vote against the American Health Care Act based on this amendment.
So remember, this also keeps the provision where they cut $800 billion from Medicare. What happened, or Medicaid? I thought you weren't gonna do that. And it turns out Donald Trump violating yet another promise. Oh, who could have guessed? So, like John was mentioning, it's cute. We still cover you if you have a pre-existing condition. By the way, unless you exchange insurance programs, in which case that's when we can really jack up your prices. But technically you're still covered. You got to pay 35 times more, but technically you're covered. And once, by the way, you have that problem with changing the insurance things, you also get more wedded to your current employer. Another nice side benefit if you're a Republican and you love multinational corporations. Oh, you want to leave your job? No, I don't think so. You want to pay 7 times more for your insurance? Go ahead, leave your job. There you go, back to work, back to the mines, okay? So now to the heart of this, I love this. One analyst said, looking at this and saying, wait a minute, if you cut all those benefits and you have no way to pay for it, and you technically cover some of these things, but it would be so much higher that no one could possibly pay it. He said, quote, the people working on this don't seem to understand the market ramifications of what they're doing, which I found to be cute. That's so wonderfully naive. No, they understand the ramifications perfectly well. Okay, the rich get richer, and if you get cancer, go ahead and die. They understand that. I know that you think, that's so monstrous, there must be a misunderstanding. There's no misunderstanding. It's actually Republican 101. So you know what happens here? rates do go lower in this plan if you're perfectly healthy and young. But what the hell's the point of insurance? At a bare minimum, if you sign on to that, you're incredibly short-sighted because you know what happens? Eventually, you get sick.
Yeah.
And then, oops, oh no, now it's gonna cost me a ton of money. Hey, that's the whole point of insurance. You know what else happens? This thing cranks up the rates for old people. Why? Because health insurance companies don't want to pay for old people. They're like, you guys are gonna get sick, so I want to charge you more. You guys got $100,000 a year post taxes just to pay for insurance. If you get cancer when you're older, you don't have it, sorry, go ahead and die, right? So I got another bad news for you if you're a conservative and you like this play. Yeah, I like it, man, I'm 28 and I think I'm healthy, I think. Okay, so I want to pay a couple of bucks less now. I got news for you, you also get older. And when you do, you're gonna get hosed.
Yeah.
So, it's Republican 101 because whoever's already doing well, if you're already healthy, you're gonna do better, okay? If you have any kind of problem at all in your life, you're a little sick, you're getting older, whatever it is, then you're gonna do worse and you're gonna like it. And here's our answer to you. Here's some goddamn bootstraps.
Yeah.
Go fend for yourself. It's a vicious jungle mentality, and that's who these thugs are. They think, hey, if I already have the money, I'm gonna survive. You don't, that's your problem, man. We're in the jungle.
It was always a lie that this was about saving money. It was about them saving money. They don't care if you pay $100 less or $5,000 more. And they don't care if you end up paying slightly less, but your health insurance is worthless. And if you actually get sick, you could potentially die or end up going bankrupt because they cap out how much they'll actually pay towards your health insurance. They care about the fact that they're going to get a massive tax cut inside of this larger bill, not connected specifically to the amendment, but to the original bill. They will save hundreds of billions of dollars over that. That's what they care about. They don't care about the quality of your health insurance, and they don't care if your plan is actually good for nothing in practice. They don't have that plan. They have the better plans that do cover everything.
And they can afford it because in this bill, there's no end to the tax cuts for the rich in every single proposal of Trump and the Republicans. In this bill, there's a $600 billion tax cut for the rich. But if you get sick, go ahead and die. But there are some Republicans who are opposed to it. There's one guy who's a little concerned. He's very conservative, but he's GOP Chief Deputy Whip McHenry from North Carolina, okay? Patrick McHenry. He says, well, my family has a history of cancer, and I know that in the old days before Obamacare, we had trouble in the individual marketplace, and we was really hard, and we couldn't afford it. I mean, even his family, and these guys are on average millionaires, right? Even his family couldn't afford it. So he's like, based on my own experience with insurer discrimination, I'm a little worried about it because
classic Republican.
Exactly, classic Republican. If it affects me, oh wait a minute. I didn't know, wait, my family could get cancer? And then they're gonna charge my family more? I'm a little concerned about this. Oh, your family, I don't care about that at all. So if we're lucky, enough Republican families have been affected by this that maybe it'll fail. If it hasn't, if the Republicans in Congress are generally healthy, they're gonna be like, didn't affect me, don't care at all. The real resistance is fighting against Trump and the establishment. Help us get investigative reporters that are going to investigate both of them. TYTnetwork.com/go.